children that might have social emotional difficulties often express themselves in ways that can be quite difficult within the classroom or schooling setting, or they may not even get to that classroom setting in the first place. So those are the children, for example, that might have emotional-based school avoidance, anxiety, depression, and so on. But also you might have children in the classroom that you may be aware of some of their difficulties regarding self-harm, for example, the use of drugs and alcohol, or eating disorders, and so on. And it's such a broad term, social, emotional, mental health. And I think one thing that the SEND Code of Practice does is it divides different needs into communication, interaction, physical, sensory, and so on. But actually, we know that those tidy groups are a lot more complex than that. We know, for example, that children with social, emotional, mental health needs might have particular difficulties with their expressive or their receptive language. They might have challenges with having their meaning conveyed and understood. And that might not be because of their emotional regulation per se, but it might be their ability to be able to express themselves and to be understood. Social, emotional, mental health is a tiny facet of a individual and child's life, but can have a fundamental impact on how they engage with others around, either individually, classroom, or socially.